Hi, my name is Christy Angel. I am a physical therapy student at Campbell University. Today I will be presenting and demonstrating a cluster of hip labral special tests. The purpose behind the special test I am presenting is to reproduce the symptoms that are clinically similar to those found with a hip labral tear. A cluster of tests is always better to do compared to a single test in isolation in order to rule in or rule out hip labral tears. I chose a cluster of 4 tests: the Scour test, impingement test, Faber's, and the Fitzgerald's test. According to the research, the impingement and Faber's test displayed a high specificity, the Fitzgerald's test showed a high sensitivity, and the diagnostic value of the Scour test is unknown. During the Scour test, the patient is supine near the edge of the bed. The physical therapist stands on the side nearest the affected hip. The hip is flexed to 90 degrees and the knee is left to flex comfortably. The physical therapist places their hands on the knee and proximal to the ankle. The physical therapist then adducts the hip to where the pelvis begins to lift off the bed for assessment of the inner quadrant. At the end of the range, a compression force is applied through the knee along the longitudinal axis of the femur. The physical therapist then flexes and abducts the hip for assessment of the outer quadrant, and a compression force is applied again through the knee along the longitudinal axis of the femur. Throughout the entire movement, hold the femur between internal and external rotation, and the movement should be a smooth arc of a circle. A positive test is felt when there is resistance, apprehension, or pain felt throughout the motion. The impingement test and the Faber's test consist of the patient lying in supine and the physical therapist standing on the side closest to the affected hip. For the impingement test, the physical therapist moves the patient hip to 90 degrees of flexion, internal rotation, and adduction. For the Faber's test, the physical therapist moves the patient's leg into flexion, abduction, and external rotation so that the knee is in a figure 4 position and the ankle rests on the opposite knee. A medial pressure is applied to the ipsilateral knee, such as this. A positive test for both would be a reproduction of groin pain, a typical labral tear symptom. The Fitzgerald's test is completed in 2 parts, the anterior labrum and posterior labrum. The physical therapist stands on the side of the hip being tested and places one hand over the knee and the other just above the ankle. Testing the anterior labrum behind the patient lying supine while the physical therapist maximally flexes, externally rotates, and abducts the hip, while then extending, internally rotating, and adducting the hip. To test the posterior labrum, the physical therapist begins with the patient's hip in maximal flexion, internal rotation, and adduction, then extending, externally rotating, and abducting the hip. A positive test would be reproduction of the symptoms or sharp pain in the area of the labrum being tested. Okay, Ms. Leilani, so in order to determine if you have a hip labral tear, we're going to do a cluster of 4 tests today to determine if it's a positive or negative diagnosis and to allow us to see which area of the labrum is affected. To not block the view, I will only perform the test on the affected hip. But in clinical practice, it is appropriate to always do it on the unaffected side first. So I'm going to get started. So we'll do the Scour's test first. Do you have any reproduction symptoms?
No.
Then the impingement test. Any there?
No.
Okay. And then Faber's. Any reproduction of symptoms?
No.
Okay. And then Fitzgerald's test for the anterior labrum. Here. Okay. And then for the posterior labrum. Here. Okay. Any reproduction symptoms?
No.